As of this morning, Eastern Maine Medical Center has 31 patients that they are treating for COVID-19. A.R. Gould Hospital has 3. Blue Hill Hospital has 2. Inland Hospital has 5. Maine Coast Hospital has 2. And Mayo Hospital has 4. And Mercy Hospital has 15. And lastly, Sebasticook Valley Hospital has 3 patients they are treating for COVID-19. In addition to that, we have 20 patients who are being cared for by our home care and hospice agency in their homes, for a total of 65 inpatients being treated across our system. So that should be a stark reminder to us that this is a real disease, that the consequences are great, and that we need your assistance. We need the help of the members in our communities to continue to wear masks and face coverings when they are out in public, that they remain 6 feet apart when they are out in public, that they stay home when they are not feeling well, and that we all remind ourselves that we need to be good stewards of our communities and healthcare. We need you to help us in this, because we need our healthcare workers who also are out in our communities to stay well so they can be here on the job, ready and willing and able to help take care of you. Now I'll transition to some good news. At Northern Light Health, we've been preparing for months for the rollout of a vaccine that can help us to stem the tide of the COVID-19 pandemic and help protect us and keep us all safe. We are delighted to say that Northern Light Mercy Hospital and Northern Light Eastern Maine Medical Center each received a shipment of the Pfizer vaccine product this morning. For those of you in the media, we will be able to provide you with still photos or video of that arrival, and we'll gladly share that with you. Due to the fact that we have increased community transmission, we will not be allowing media in at this time. As we have prepared for this vaccine distribution, we have set up a system so that we can make sure that we vaccinate the healthcare workers who are at most risk right now because they are taking care of individuals who have COVID-19. And so we want to protect them, again, to keep them on the front lines, taking care of our patients and each other. This has been a dramatic improvement in what the information that we've been giving for the last couple of weeks. After reviewing the documentation after the emergency use authorization by the FDA, the Federal Drug Administration, on Friday, we feel confident that this vaccine is both safe and effective in treating, in helping to prevent the spread of COVID-19. We are delighted by this news. We are also well aware that the Moderna product will be going up to the FDA for emergency use authorization this week, and we expect that to be approved as well. That will give us 2 vaccines, both in very limited supply initially. So when we talk about distribution, we are talking about to healthcare workers and to those people living in long-term care or skilled facilities and their workers first. And then we will follow the CDC's guideline as far as phased approach to distribution of that vaccine. We are working very closely with our partners across the state and the Maine CDC in making sure that we are doing this in an equitable and safe fashion. And with that, I'll turn it over to Mr. Boland to talk a little bit more about our plan here at Northern Light Health.
Good morning, and thank you, Dr. Jarvis. As Dr. Jarvis mentioned, we're delighted that the vaccine has arrived at Northern Light EMMC and Northern Light Mercy Hospital. We anticipate starting our initial vaccination clinics of our staff in a priority order in a phased approach. So the most employees with COVID interaction will be vaccinated first. We expect those vaccination clinics to start this Wednesday.
So with that, we'll open it up to questions. And so, Andy, I'll leave it to you.
Okay, so we'll start with WVII. Joe, you should be unmuted. Go ahead and ask your question. Joe? Try one more time. All right, well, we'll come back to Joe. So next is WERU, Amy Brown.
Thank you. Can you say whether it's recommended that people receive the vaccine, if they, excuse me, have recovered, if they've had the virus and recovered, will they still be somewhere in the pipeline for receiving the vaccine? And also, is it known what would happen if someone were positive and asymptomatic, perhaps didn't know they were positive and received the vaccine?
So the question was, is individuals who had a known positive case of COVID-19 and recovered, should they receive the vaccine? At this time, there is no specific guidance around that possibility. We do expect that it would be safe for someone who was previously infected with COVID-19, whether symptomatic or not, to receive the vaccine. We feel that that is a safe approach, but more guidance will be given to us. At the present time, we are not recommending the general population who have had a positive COVID-19 disease to be vaccinated at this point. But again, for the general population, we are not vaccinating them simply due to limited supply of the vaccine and are focusing in on healthcare workers. If we know that we had a healthcare worker who has been positive, we will have an individual discussion with that person.
And well, in terms of the other question, somebody being asymptomatic and getting it, will all of the employees be tested before they start receiving it? I'm thinking about that more for the general public as it moves into expansion, but what would happen if someone received it who was positive?
We expect, as we've seen with other vaccines, that would probably, if anything, would just simply have a more induced immune response, so a more positive response from the vaccine, but we don't know any clear data on that, and all of that stuff. All of those kind of things are being looked at by the teams that are working on the research for the original authorization for the vaccine. So Pfizer and Moderna will continue to follow the individuals who were initially treated with their vaccine to see how those go, but we do not expect that would cause any complications.
Great, thank you.
Next we have Patty White, Maine Public. Go ahead, Patty.
Thank you very much. Can you paint us a little bit of a picture of what this is going to look like when you start administering the vaccines to staff? Is it going to be, appointments, and how quickly do you expect to run through this first allotment of doses?
So that's an excellent question. The question is how are we looking at this vaccine distribution initially? So we have already identified categories of staff who we feel should receive the vaccine first due to risk. We need to stratify that because obviously we don't want to vaccinate an entire department and then have the chance that that department may not be able to work for the next day or so due to common side effects from the vaccine. And so we need to do a staggered approach there. We expect that we will be able to administer the vaccine fairly quickly with the limited amount that we have. We are very good at vaccinating people. If you think about it, every single year we administer the influenza vaccine across all of our healthcare workers as well as all of our patients, and we do that without any difficulty. At the same time, we continue to vaccinate children against childhood diseases as well as adults for their preventative care. So we do vaccinations very well. We will make this a much more coordinated effort than we do with influenza, so that our staff will be scheduled for their appointment. That is key for us, one, so we can monitor who we're giving the vaccine to, and two, to make sure that we can get them their second dose at the appropriate interval that needs to be done. And so all of this will be done in a very coordinated fashion. Paul, do you have any other further comments?
No, I think you covered it, Dr. Jarvis.
Okay, thank you for the question.
Great, thanks. And can you tell us also a little bit about some of the challenges of preparing for this, just because so many of the details haven't been known until the last minute? Just give us maybe some examples of what's been challenging about getting ready for this.
Information technology infrastructure is always a challenge, and when you're trying to create something brand new, becomes challenging, but we have a fantastic team at Northern Light Health. I continue to tell people that what we did in 4 weeks typically would take a year, and that's because everybody has been dedicated for this moment, for today. We have been striving to make sure that we have done things accurately and safely for today. It is challenging in that we did not get the full release of information from the FDA until late Friday. So our teams have been working over the weekend, reviewing that data, making sure that it meets our standards. Today, our formulary management team will be meeting in order to review that data once more to make sure that it meets all of our requirements before we administer that vaccine. But it was pre-planning, putting everything in place for this moment that is going to help us to get around those challenges. Coordination of staff will be a challenge.
Thanks.
In addition to that, one of the initial issues that we overcame quickly, but was pending information, was the quantity of vaccine to be received at each location and the timing of that. So internally, identifying by risk which groups of employees would appropriately receive the vaccine first. It's important to know also how much vaccine you'll have available. So we found that out late last week and put that into our plan. And so we're working very quickly to administer that vaccine in that order.
Okay, next we have Brian Sullivan, WABI. Go ahead, Brian.
Yeah, thank you. I have a question about did you get, I guess we would heard 975 doses. Is that what you got this morning? And when do you expect to get your next delivery of doses?
So yes, Eastern Maine Medical Center was expected to receive 975 doses today, as did Mercy Hospital. We expect that A.R. Gould will be receiving their shipment either today or tomorrow, and with similar shipments being given throughout the state as well. We have confirmed that we expect that the same number of dosage will be given to us for next week, that for the state. However, knowing what it is that will be distributed to Northern Light has yet to be determined. And so we will know that information as the week goes on. And then we are hopeful that we will be seeing the Moderna vaccine either next week or the following week. Again, that just depends on the approval process for those. But we do expect at least through the end of December that we will have a fairly steady shipment of vaccine, either the Pfizer or the Moderna. But right now we're going to focus in on those dosages that came to the state today, and again make sure that those are distributed in an equitable fashion in order to protect those healthcare workers who are at most risk because they are dealing with patients who are positive for COVID-19.
And can you explain to us a little bit the process of actually delivering the vaccine? I mean, we've heard that this needs to be stored at extreme low temperatures. So how long can you take it out? Do you bring the people to these super fridges that you have, for lack of a better word, or how does that work as you deliver the vaccine?
Yeah, so that is correct. The Pfizer vaccine is the one that needs to be in the ultra cold freezer. Northern Light Health was using some forethought and purchased 4 of those and have them distributed across the state in key locations. So that is why EMMC and Mercy Hospital received their allocation today, because they are prepared and have those freezers readily available to them. It is a process. Once we get that distribution on the day that we are going to administer vaccines, the vaccine does need to be thawed. It then needs to be reconstituted, and then it has a very short period of time where it can be where it can actually be utilized. Because of that, the state of Maine has decided that hospitals that have access to those ultra cold freezers will be getting the Pfizer vaccine. For Northern Light, we will be bringing individuals closer to those locations for distribution and administration of the vaccine. So individuals will be coming to the medical center here in Bangor for their vaccine administration. For the Moderna product, that is a more stable product and therefore can be distributed to hospitals who do not have that ultra cold freezer, and will allow us a little bit more leeway into where we can hold those clinics. But right now for Northern Light, we are expecting that all of our clinics will be housed either within each hospital or close by each hospital in order to make sure that we can keep a good eye on that vaccine. Obviously, it is very precious as it is in limited supply, and we want to make sure that we are vaccinating the greatest number of people in the shortest amount of time.
Okay, next up we have WMTW, Mary Kate.
Hello, good morning. I just have 2 questions. If I may ask the first, what was the feeling like to receive those shipments today?
As text messages went out that the vaccine had arrived both at Mercy Hospital and Eastern Maine Medical Center, I will tell you that lots of smiles on people's faces. That those smiles were short-lived, because we do have to deal with the reality of the number of patients that we are caring for currently with COVID-19 and the fact that we need to protect each other. Despite the vaccine, we will still be wearing face coverings at the medical centers and the hospitals. We will still be wearing masks and eye protection for a period of time. We are still in this for the long haul. Yes, we are jubilant, but at the same time, we have to recognize the realities.
And if I may ask my second question, have the employees who have already been identified as being possibly the first in line for this, have they been notified? And if so, can you share when, say, the first shots will be going into arms this week?
So we
Or
are
if it's this week.
currently working on that process. We did not want to get ahead of ourselves just in case there was a problem either with the authorization or with the supply chain distribution. This is the challenge that we were talking about before. With flu vaccine clinics, we usually set those up months in advance. With this one, we are literally doing it hour by hour. We expect that we will be starting our first vaccine clinics Wednesday morning at several of our locations.
Okay, next up we have Leslie Landrigan, Penobscot Bay Press. Go ahead, Leslie.
Sorry. I had a problem unmuting. Am I unmuted now?
You are. Go
Yep,
ahead,
we
Leslie.
can hear you fine.
Okay, good. Dr. Jarvis, thank you. I'm curious about how you would handle a situation like the Island Nursing Home, where all but 3 of the residents have had virus, and it's pretty far away from either of the big hospitals, and it's really lightly staffed. So would the Island Nursing Home be likely to be getting any vaccines?
So I'll say that for the state of Maine, the determination was made that for our long-term care and skilled facilities, that they would use the federal contract with CVS and Walgreens for distribution of vaccine to both residents and staff at those type of facilities. So I'll refer you back to the Maine CDC for details on how that specific location or other locations across the state will be handling that.
Great, thank you.
Leslie, did you have a follow-up?
Oh, no, I'm sorry. That was, well, I guess I did. I was wondering how a rural area like the Blue Hill Peninsula and the islands would fare in terms of vaccine distribution.
So again, the initial phase for rollout will be through hospitals. And so initially, the Pfizer vaccine, as we talked about today, is going to those locations that have an ultra-cold freezer. The Moderna vaccine will be following that once it gets its approval, and that will be distributed again through hospitals. As far as vaccination of the general population, those details are still being worked out in the state of Maine. Northern Light Health is proud to be a partner with the state, and we will help the state in any way we can to see that we get all of Mainers vaccinated as we should do in a timely fashion and when it is safe to do so.
Okay, next up we have Jackie, News Center.
Good morning. Thanks so much. First, just a question on masks. I know there are 2 doses of the vaccine. So you get one, then you wait a period of time, and then you have another one. Are you still supposed to be wearing a mask? And should you be wearing a mask until the pandemic is, over? How is that going to work?
Yeah, so the question was, should we continue to mask? Do we have to mask after we get our first or second dose of these 2 vaccines? The answer is yes. The way vaccines work is they do give some protection to us, but they are not the overall protection that we have. And we talk about this all the time. When we talk about influenza season, we tell people that the number one thing to do is get your vaccine, but you still need to practice good hand hygiene. And now with COVID-19, the same rules apply, except with more precautions that we have to take. So while the vaccine is going to be an excellent start for us to be getting the virus under control, we still need to take those same precautions. Think about it again as my analogy that I like to say all the time about cars. So the vaccine is like the brakes on our car. So we want our brakes to be there, but we also need to wear our seatbelt for when our brakes break down, and we also need to have those airbags in place. And so the masking and the social distancing, staying home when we're unwell, not doing mass gatherings, those things are all still going to need to be in place because vaccines are never 100% effective. There is always the possibility that someone can still get the virus even though they have been vaccinated. And certainly we know there are those people in our population who either choose not to be vaccinated or for medical reasons cannot be vaccinated. And so we need to protect them regardless. And so yes, we will still be wearing masks. We will still be doing our social distancing. And we will still be asking you not to congregate in large settings until we know that the virus is completely under control. And that may take 6 months or more. While today is a great day, it is not the end of the pandemic, but it is a light at the end of the tunnel.
And just one more question. So if a household member is a frontline healthcare worker and is getting a vaccine, in the next coming weeks, what does that mean for you? Are they going to be injected with COVID-19? Should they social distance from their household members? How would that work?
So that's an excellent question about how this vaccine works. So both the Pfizer vaccine and the Moderna vaccine are not live viruses. They are actually manufactured messenger RNA that actually stimulates your body to produce one protein of the virus, and then your body will have its immune response to that one protein. There is no way that that the vaccine can cause the virus to occur because it does not contain the components of the virus to do that. And so there is no risk to anybody else from an individual who has been vaccinated, nor is there risk beyond the normal side effects that a vaccine occurs from the vaccine itself. Again, we think this vaccine is extremely safe, and the Moderna one as well. And so that is why we are promoting the vaccine, and that is why we will most likely be offering it to our staff this week.
Okay, next we have Bangor Daily News. Charlie, the floor is yours. Charlie? Looks like you're unmuted. Are you there, Charlie? Okay, well, we'll go back to Charlie. We'll move on to Portland Press Herald. Rachel Ohm. Hold on just a sec. There you go, Rachel. You should be able to unmute.
Okay, thank you. Yeah, I'm wondering if you guys are going to require the vaccines for employees, and just kind of what you're thinking is if you have any employee who maybe doesn't want to get vaccinated for whatever reason.
So I'll answer those questions. So one was, are we going to require it? And then two, what if a healthcare worker declines? So first and foremost, we cannot require a vaccine that's under emergency use authorization. And at this time, Northern Light Health has no plans to require the COVID-19 vaccines. We will follow what the guidance comes from both the federal and state CDC when that's appropriate. But right now, as it's only under emergency use, that will not happen. For that exact same reason, we will allow individuals to decline. However, we will strongly recommend that they get the vaccine. If they do decline, we will put them back in the queue if they were to decide later on that they would like to accept the vaccine. We will just reprioritize them as we're going along. But at this time, we have no intention of requiring that vaccine.
Okay, and my other question is, I just wanted to double check the numbers on how many doses you guys received. Is it 975 each at Mercy and EMMC? And does that include the second dose that you have to get?
So that's an excellent question. So yes, it was 975 at each. I will say that the state has a distribution program, and so those numbers may not be the final numbers that hospital will be utilizing. So I want to be clear about that as a state, we have decided that we need to protect as many healthcare workers as we can, and so distribution will be based upon that. As far as, so I'm sorry, the second question was?
Oh, so the vaccine you have to get like a second dose, right? Like a booster. Is that included in those numbers, or would that be something additional?
So excellent question. So we have confirmed that Operation Warp Speed has determined that they will give the initial dose, and that the government will hold back that second dose and deliver it on time. And so we expect that today we got our first shipment, and that 3 weeks from now we will get our second shipment with a number of doses to cover those people who were vaccinated initially. So yes, we will be able to vaccinate. Those full totals will actually represent the full number of people who get vaccinated.
All right, we're just troubleshooting with Charlie, and it looks like we might have that technical issue fixed. So probably going to unmute you and see if it works this time.
Yep. Can you hear me now?
Yes, we can, Charlie. Go ahead.
Great. Okay. So the first question is for Dr. Jarvis. Can you provide more of a breakdown of the types of workers who will be getting the initial doses of vaccine and across which facilities?
So initially for Northern Light, our vaccinating program will be at Mercy Hospital, Eastern Maine Medical Center, and then at A.R. Gould once they receive their first shipment. So that's where we will be doing those vaccines. Our prioritization list really is staff who come in contact with individuals who are COVID-19. So that would include our providers, our nursing staff, our EVS, housekeeping staff, our dietitians, those who work on those floors. We are not prioritizing by anything other than than individuals who come in contact with COVID-19. I'll defer to Mr. Boland to give a little bit further detail on that.
Thanks, Dr. Jarvis. That's accurate. The intent really is to make sure that the people most at risk in interacting with patients positive for COVID-19 are vaccinated first. And so the full spectrum of the care team, providers, support staff, nurses, and others who are interacting with those patients as part of their care are prioritized into that most urgent group.
Okay, and then just a quick follow-up from that before I ask my others. So will providers from other hospitals, say Inland and Waterville or Maine Coast and Ellsworth, be coming to EMMC to get vaccinated with this initial allocation?
So not at this time, because we fully expect that we will be getting shipments of the Moderna vaccine next week. And so the state's plan right now is that those places that have the ultra-cold freezers will keep their vaccine, other than the distribution between the hospitals that have ultra-cold freezers as predetermined by the state. And that the second round of vaccinations for other hospitals will be based on the Moderna vaccine. And so that's how we will be doing that. We will not be having people come from all over the state to get to one location or another. We want people to get their vaccine close to home, and we will try to accomplish that as best as possible. And similarly, we will try to do the same thing once we get to vaccinating the general population. We want to bring the vaccine to you, and that is what we will strive to do.
Okay, and then just can you offer any update on the capacity at your hospitals to handle COVID admissions right now? I mean, are you any closer, do you think, to having to move ahead in your surge plans by, say, delaying elective procedures or anything like that?
So I'll just say that we flex up and down of our surge plans on a regular basis. And so a hospital may be at surge plan 1 today and have to go up to surge plan 2 or 3 tomorrow. Eastern Maine Medical Center probably has had to flex the most because its numbers rise and fall due to its regional capacity and its purpose as a regional medical center. And so that's a normal part of our daily basis. We continue to do that on an everyday basis. Right now, we feel we continue to have capacity not only to take care of patients who have COVID-19, but also to take care of our other needs and healthcare concerns, as well as continue to provide elective procedures. I will say that our surgical teams, our executive team at the surgical level, review that as well on a daily basis. At this time, we have no intention of curtailing elective procedures on any widespread basis. There may be some individual cases that need to be postponed, but right now we feel we can handle the capacity and the needs of our communities, and we will continue to strive to do that. We want to make people understand we are open for business, both on the critical care and the acute care setting in our hospitals, but also our ambulatory practices continue to see patients. We know that you have chronic health conditions that need addressing. We know that you have preventative health care concerns that need to be addressed, and we will continue to do so. So please do not hesitate to reach out to us for your health care needs. We are open, ready for business. We are using telehealth far more than we ever have before, and so that is an opportunity for people to stay home but still receive the great care that they need. So thank you for that question.
Okay, next up we have Marissa, WGME.
Hi, Dr. Jarvis. I know you mentioned individuals who are interacting with COVID patients will be first in line. Can you give us an idea of how far this initial batch of doses will go? I mean, will that cover all of your workers who are interacting directly with COVID patients, or half of them? Can you just give us kind of an idea?
So I'm going to refer that to Paul, because Paul is the one that's handling the actual numbers, and my role would be to oversee the process. And so I'll turn that over to Paul.
So the question was, does the initial supply of vaccine, is it sufficient enough to cover all those employees who are taking care of COVID-positive patients? A qualified yes to that, in that we have identified groups that are the most interacting with COVID-positive patients, and that group is of a size or quantity of people that is less than the supply of vaccine that we anticipate receiving. In addition to that, we have our surge plans in place, and so it's people who are taking care of COVID-positive patients today, and then the next tier of employees who could be taking care of COVID-positive patients if we had a surge going beyond today's capacity. So that's the way that we've identified the different phases for employee vaccination. But yes, to answer your question, those who are caring for COVID-positive patients, we do have sufficient quantity of vaccine to vaccinate that group of employees with this initial shipment of vaccine.
And I know, in the UK, allergies were brought up as a concern. There's been some talk about whether pregnant women should get the vaccine. Is there any more clarification today about maybe what medical conditions it's not recommended for at this point?
So reading through the emergency use authorization guidance, as well as the guidance from the Advisory Committee on Immunization Practices, which is an independent body from the FDA, the issue around pregnancy is unknown at this time. It has not been studied well enough in children under the age of 16 or women who are pregnant, and so at this time we would preclude women who are pregnant from getting vaccine until we know further details. As far as the issue with allergic reactions, it appears that there were 2 healthcare workers in the UK who had severe allergic reactions after the administration of the vaccine. It is still unclear whether those were actually related to the vaccine itself or to an underlying condition of those 2 healthcare workers. This was looked at in depth by the Emergency Use Authorization Committee of the FDA, and at this time they do not feel that there is a significant risk for severe allergic reactions to the vaccine, and therefore have not made any cautionary disclaimers for that. I will say that, again, we are very good at administering vaccines. We understand the risk of giving vaccines and are prepared for those. We will have on-site people who can treat if somebody was to have a severe allergic reaction following the vaccine. And we have put some internal precautions in for those individuals who may have had allergic reactions to things outside of the product inside the vaccine. That we will have them they will allow them the ability to wait longer before being dismissed either to home or work after they've had the vaccine administered to them. So we're taking all precautions, but I do want to stress, we feel this is a very safe vaccine and feel that we will be saying the same things about the Moderna vaccine in a week. This is a very safe vaccine. Very few of major issues occurred in the trials that led to this emergency use authorization.
Okay, and last but not least, we're going to go back to Joe at WVII. I've heard that you have your technical issue taken care of, so the floor is yours, Joe.
Hopefully you can hear me now.
We can, Joe. Thank you.
Perfect. All right. Well, the first question I had, it's actually the only question I have, is we're dealing with a limited supplies. There's a lot of variables. It seems as if there's a small margin for error. What kind of guidelines were you given by the government, and what kind of guidelines or conversations have you been having with the healthcare workers that are going to be handling this fragile substance?
So that's an excellent question. So I will say that the guidelines that we are following are readily available to the general public. The federal CDC's guidance and the FDA's guidance was that states would handle the distribution. In the state of Maine, Maine has determined who will get those vaccines, and we will follow the protocols that were put in place. As a collective group, we have decided that it is important for us to protect that fragile infrastructure of healthcare and making sure that we can continue to keep people on the front lines to take care of not just patients with COVID-19, but all patients with acute issues such as heart attack, stroke, things like that. And so that's the reason why our distribution is the way it is, and that's the reason why our rollout plan is the way it is. And so that is the guidance that we follow, and we'll continue that. We further stratified based on what the needs are because of the limited vaccine that we are getting. However, we are very hopeful, and today I am more hopeful than I was last week, that we will see shipments of both Pfizer vaccine next week as well as Moderna vaccine, and so that will help it so that we can continue to vaccinate more individuals. So once again, I just want to thank you as our community partners in getting our messaging out. Please remind people that while this is a great day, it is not the end of the pandemic. Please remind people, stay home when they're not well. Don't gather in large places. Wear your face covering when you're out in public. Stay 6 feet apart. Remember, you're not just doing this for you, you're doing it for everybody else. So thank you all.
Thank you.